There will be, I just want to point out on the program, there is a 25-minute session for all the panelists to engage in free-form discussion and more question and answer. So if you have questions for these folks or those coming up, you will have another chance. So this session, we will be looking at the model of controlled access to individual company, institution, or researcher data. And our two discussants and brief presenters are Joe Ross from Yale and Ira Scholson from Georgetown. And I guess we're starting with Joe.
Is this on? Yes. Excuse me, I have a little bit of a cold. Thank you again to the committee for having me back. This is a great opportunity. I think I interpreted our what we're supposed to talk about a little bit more concretely. I'm not going to be talking explicitly about the Yale University Open Data Access Project, which I've spoken about before to the committee, but I'm going to talk a little bit more generally about the pros, cons, and challenges of controlled access. But I am here on behalf of the entire group. And I do want to note our relevant financial relationships, which is that we have research grants through Yale to develop policies and procedures that facilitate company clinical trial data sharing from Johnson & Johnson now, and also from Medtronic. So the idea of controlled access is very simple in some respects. There's individual companies' data, and there's an applicant investigator, and somehow we're going to control access to this, right? And it can be very severe controlled access, right, where we have set up the data behind Fort Knox with a lot of blockades that are preventing access to it, or it could be very facilitated, where we're essentially opening the door and we're saying, we have this, we have some very simple requirements, and we want you to come in and use our data. And this idea really does span a spectrum, and I was sort of brainstorming ideas on what controlled access could look like, and I sort of start here at the top of the least controlled, right? You could have very simple just registration of the investigator name or subsequent information, the other information of collaborators, their credentials. You could require a scientific proposal with a pre-specified analysis. You could require that the results have to be reported at the back end of it. You could make all of this publicly reported, making it quote-unquote more or less controlled. You could require registration and scientific approval, and that could include a soundness review. You know, did they submit a proposal that simply appears to represent science? Or you could do a merit review where you're actually having a peer review system that provides comments back to the investigators who are applying for data about their innovativeness or the methodological rigor. On the same time, you could have the scientific approval process being done by a third party, you know, an independent organization that's separated from the company that owns the data and the applicant who's putting in the data request, or this could be done by the data generator as part of their making the data available. And finally, you could have registration, the scientific approval process, along with a fee, making the data available. And so this is just a sort of simplistic representation of what controlled access might look like. There are a number of advantages to controlling access, right? First of all, just to say that providing any controlled access to data promotes open science and transparency. You are making that data available, and it's a step in the right direction. Requiring registration has the potential to facilitate good stewardship of clinical trial data when there are explicit requirements and regulations that are governing the data availability. Results reporting, making the results of these analyses publicly available, has the potential to address selective publication and selective outcome reporting bias, which are some of the important issues that actually brought us to the table around data sharing in the first place. And then requiring proposal and third-party review, or even by a data generator, has the potential to facilitate rigorous science. And if it's done independently, by the third party, there's obviously the idea of independence. There are disadvantages as well. Any barrier is a barrier to access, which could diminish the use of the data and its potential to improve public good. Requiring a fee diminishes opportunities among young scientists and among those without resources, right? Requiring scientific review by the data generator diminishes the appearance of independence. And requiring even a proposal demands that there's trust in the scientific review process, regardless if it's done by a third party or a data generator. And so let me just take a moment to lay out some of the challenges that I think are particularly posed to the idea of the controlled access model. So first, the idea that controlled access requires application of a fair yet comprehensive data access policy. And this is a delicate balance of competing interests. As soon as you start to try to do it, you realize, you know, people, when you try to take the middle ground, people on both sides criticize you. So and I guess that's probably where you want to be, but establishing that idea of a fair policy is challenging. There's the idea of who pays for controlling access and how much should they be paid, right? So the tremendous amount of resources are invested in collecting this data. who is going to pay for cleaning the data, de-identifying it, and making it available, having these third-party reviews or data generator reviews. Another challenge that I think is very important to address is who provides oversight of the scientific review process, either by a third party or data generator. The third party may be establishing themselves to be in the space between the data generator and the data user, but who's sort of, who's watching the watcher, right? So there should be some oversight and a lot of transparency around that process. And then who provides oversight and surveillance of the applicant investigators? Who enforces the data use agreement if it's broken? Is the data being used as it was proposed? Is the scientific approach being followed as it was proposed? And are all analyses being disseminated as was required? And that is it. So thank you.